Hi everybody, and welcome to your peripheral vascular assessment lesson. The objectives we'll be covering with this lesson will include information from this podcast and information that we cover in class. Please take a minute to look over the objectives. If you are taking this course in blended format, you will be asked to do a student activity on a site called Padlet, and information will pop up through Edpuzzle to let you know the link that you should go to and what you need to do. If this is a face-to-face class and you are watching this podcast, we will be doing the activity in class. When we're talking about a peripheral vascular assessment, what we're talking about is circulation and making sure that there's adequate perfusion peripherally. So when we did the heart and neck vessels, we talked about the carotid arteries here and also the apical pulse for the central vessel circulation. Now we're talking about the peripheral vessels, and we want to make sure that there's adequate circulation getting to the different body parts. So we're talking about the different pulses that have to be present that let us as nurses know that there is perfusion, that there's adequate circulation getting to all of the body parts. So again, we've got central vessels here, which we've already learned. Those are the carotids. You've got your apical pulse here, and now we're concerned about the peripheral pulses. The brachials, which you would have already learned about their location in A and P. We've got the radial pulse right over here on the thumb side. There is an ulnar pulse that is generally not palpated. Femoral pulses right in the groin area. Popliteal pulses behind the knee. And then we've got the pedal pulses right about on the top of the feet. And the tibial pulses right at the side of the ankles there. So those are the pulse point locations, which you should have already learned in anatomy and physiology. And in this class, we're going to learn how to assess for the presence of the pulses. So this slide shows you exactly where you're going to be palpating the pulses. I realize you probably have learned some of this in lab. Some of you have had experience with this, but it's important because it's an assessment class that it's reviewed again, because it is a very important assessment skill. In the first one here, you've got the radial pulse, which is palpated on the thumb side. Okay, so what we're doing when we're doing a peripheral vascular assessment is we're using our fingers, never our thumb, because we've got a pulse in our thumb, to palpate for the presence of a pulse. In the next one, we've got the brachial pulse, which is right in the antecubital space, again, using your two fingers. The femoral pulse is going to be right around here in the groin area. Now, we're not going to do that on each other for obvious reasons, but I do want you to know in clinical practice that it's a very important assessment skill. When patients have had lower extremity surgeries, if it's an area that we've got to watch for people who have had cardiac catheterization. So while we're not going to do it on each other, I do want you to be aware that it's important. Popliteal pulses are behind the knee. The dorsalis pedis, usually about the center of the dorsal part of the foot. And then the posterior tibial is usually on the side of the leg toward the ankle. Grading of the pulses. If you don't feel a pulse, it would be a 0. 1+ is weak. 2+ is what we expect to find on each other when you're assessing your partner. 3+ would be very full and you would feel it even stronger than you normally would, and 4+ would be bounding. Assessing these different types of graded pulses is going to take practice in the clinical setting, because on each other it's generally going to be a 2+, but I do want you to know that 2+ is normal. If there is ever a question about whether or not a pulse is present, many times a Doppler ultrasonic stethoscope will be used, because sometimes a pulse can't be palpated, either because it's so weak or there's so much edema to the extremity, And in that case, the Doppler ultrasonic stethoscope is useful. Another assessment that is done in addition to pulses is assessing for pretibial edema. And that simply just means the area in front of the tibia of the lower leg. So what you do is you take your thumb, you press for about 5 seconds, and then you feel for any kind of indentation. And the reason that we're looking for that is because whenever there's swelling to the lower extremities, you have to question whether or not there is a perfusion issue as well. So we want to make sure that if that's present, we're carefully assessing for pulses. So we talked about pulses, we talked about pretibial edema. Another very important assessment that you need to make sure that you're performing are the 5 Ps. So, and this would be on the extremities, not just the lower extremities, but on the arms and hands as well. Is there pain present? Are the pulses present or absent? Pallor. You want to make sure that you're comparing the 2 extremities and looking for pallor, which of course is a pale look where the color is draining, which would mean that there's not adequate circulation. Is there paresthesia? Okay, is this person able to feel when you're testing either by touch or another method? Are they able to move the extremity? So you're going to have to know the 5 Ps for peripheral vascular assessment. And here's why we do a peripheral vascular assessment. We want to prevent people from getting into trouble like you see here. If you look up in this area, this is an example of necrotic tissue. Okay, so that is where gangrene is probably going to set in at some point if it hasn't already. But these fingers are necrotic, which means the circulation has been cut off for whatever reason. In this example, you're starting to see a dusky look to this foot, which may mean a perfusion issue. Here, look at the pallor of the fingers. Okay, so the circulation is cut off. And there's certainly a perfusion issue for whatever reason here. This person had a fasciotomy because there was compartment syndrome, which you'll learn about. Had to relieve the pressure so circulation could get through. So you can see where the nurses marked the pulses to continually assess those pulses and make sure that there's adequate perfusion. Here you've got an example of swelling. As compared to the other extremity, certainly would want to make sure that there's pulses present there so that the circulation is not cut off. So these are the kinds of things that we're looking for so that the person doesn't end up losing an extremity. So at this point, I want to show you a video that demonstrates the peripheral vascular assessment as I want you to do it. The only thing she does not do here is assess for the 5 Ps, and in class I will remind you that that's something that you're going to have to do, and it's also listed on your rubric if you want to look ahead on that. But she does do a demonstration of everything that you're going to need to do.
Hello, my name is Carolyn Merriman, and I'm going to be your nurse today. Can you please tell me your full name?
Lita Jones.
Okay, Miss Jones. Well, I've washed my hands, and what I'd like to do is check your armband. Okay, Miss Lita Jones. And can you also tell me your birth date?
4/1967.
Thank you very much. Well, today, Miss Jones, what I'd like to do is do a peripheral vascular exam, which what that means is I'm just checking your circulation. So, what I'd like to do first is take your blood pressure.
Okay.
This is the electronic blood pressure. I'm palpating for the brachial artery. Are you comfortable?
Yes.
All right, it's going to squeeze your arm. All right, that should be done good. And so
Along the way, I have the video stopping to just remind you that you do not have to take a blood pressure, but you have to verbalize that it would be part of the peripheral vascular assessment.
So your blood pressure was 120/80. Thank you very much. All right, next, Miss Jones, what I want to do is just look at, I'm looking at your skin color to make sure your skin color is okay. But what I want to do is just check your radial pulses, which is right by your thumb. So I'm palpating your radial pulses at the same time and comparing them for equality, and so I can feel them and they feel equal, and I would rate them about a 2 plus.
So for this, I'm going to have you inspect the skin color, and even though she doesn't do it, I want you to palpate the brachial pulses and the radial pulses. Normally, if you palpate radial pulses, then there's not a need to palpate the brachials, but for this course, I'm going to ask you to do it.
Okay, and now what I'd like to do is look at your fingers, and what I'm doing is I'm going to squeeze your fingernail for capillary refill. I'm going to do that on both sides. Okay, that's excellent.
So you'll inspect the fingers for capillary refill bilaterally. And normal is 2 seconds or less, if you remember, and you only have to squeeze one finger on each side.
Now what I'd like to do, Miss Jones, is do the same thing down at your feet. So I'm going to uncover your foot here for a second, and I'm going to take off your socks. And what I need to do is check your pedal pulses. Those are pulses that are on top of your feet. And so at the same time, I'm going to be palpating for the pedal pulses. Again, they're equal, about 2 plus. I'm going to just briefly check the big toe for capillary refill. Looks like it was fast, and it was less than 2 seconds. So you press and then you look that it's come back very quickly.
So I'm going to ask you to locate the area where the popliteal pulse may be palpated, because I do want to make sure that you know where to do that. And then you'll do what she did, where you look for the pedal pulses and assess them. She calls them pedal pulses. It doesn't matter. I've heard them referred to both ways. It all depends on how you learned it. And then inspect for capillary refill of the toes bilaterally.
Have you down here on this part, I want to just raise the blanket up just a little bit so I can check for edema. So pretibial edema. So what I'm going to do is press for 5 seconds. 2, 3, 4, 5. Run my hand down over to see if there's any indentation, and there's not. So you do not have any pretibial edema, and that's what I will record.
Okay, so you'll inspect for pretibial edema just like she did. The tops of the shins, you press with your thumbs for about 5 seconds, and then you run the backs of your hands down the shins to see if there's an indentation present.
So this concludes the assessment for your circulation. I'll help you get your socks back on.
So that brings us to the end of the peripheral vascular assessment lesson. And again, we're going to practice in class. I would like you to try to practice on somebody at home so that you get as much experience as you possibly can. And in class, we'll go over it again and clarify some points that may be unclear to you.